15 risk factors of breast cancer most women don't know. Did you know researchers identified that 1 woman out of 8 will develop breast cancer during their lifetime? Do you know why breast cancer is affecting more and more women in the world today? Have you ever wondered why some people have breast cancer and others do not? Or why in some families breast cancer is more common and in other families nobody is affected? What actually predisposes people to breast cancer? Well, if you've ever asked yourself any of these questions, I guess you found the right place for answers. But before we start, you must understand that cancer was rated by the World Health Organization in 2018 as the second cause of death worldwide. Cancer grows when a cell's DNA is damaged, but why or how that DNA becomes damaged is still unknown. It could be genetic or environmental, or in most cases, a combination of the two. But most patients will never know exactly what caused their cancer. A risk factor is anything that increases your chances of getting the disease, such as breast cancer. But having a risk factor, or even many, does not mean that you are sure to get the disease. However, the risk factors that are associated with breast cancer can be classified into 2 groups. Those that can be controlled or changed or modified, and those that can be controlled, not changed or modified. In this month of October, which is the Breast Cancer Awareness Month, it is important to be proactive about your health. In this video, we will be showing you 15 risk factors of breast cancer most women don't know. If you're new here, you can consider subscribing to this channel so that you will receive a notification whenever we put a new video online. Let's start with the risk factors you can control. 1. Weight. Being overweight is associated with increased risk of breast cancer, especially for women after menopause. Fat tissue is the body's main source of estrogen after menopause when the ovaries stop producing the hormone. Having more fat tissue means having higher estrogen levels, which can increase breast cancer risk. The American Cancer Society recommends you stay at a healthy weight throughout your life and avoid excess weight gain by balancing your food intake with physical activity. 2. Physical exercise. Evidence is growing that regular physical activity reduces breast cancer risk, especially in women past menopause. The main question is how much activity is needed. Some studies have found that even as little as a couple of hours a week might be helpful, although more seems to be better. How physical activity might reduce breast cancer risk isn't clear, but it may be due to its effect on body weight, inflammation, hormones, and energy balance. The American Cancer Society recommends that adults get at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity activity each week, or a combination of these, preferably spread throughout the week. 3. Drinking alcohol. Drinking alcohol is clearly linked to an increased risk of breast cancer. The risk increases with the amount of alcohol consumed. Women who have 1 alcoholic drink a day have a small, about 7% to 10% increased risk in having breast cancer compared with non-drinkers, while women who have 2 to 3 drinks a day have about a 20% risk than non-drinkers. Alcohol is linked to an increased risk of other types of cancers too. The American Cancer Society recommends that women who drink have no more than 1 drink a day. 4. Poor diet. A high diet in saturated fat and lacking fruits and vegetables can increase your risk for having cancer. The Women's Health Initiative trial suggested that a diet very low in fat may reduce the risk of breast cancer. In the meantime, here's what dietitians suggest. Eat foods high in omega-3 fatty acids like sardine fish, kidney beans, leafy greens, and many more. Eat plenty of vegetables and fruit. Try to limit your saturated fat intake to less than 10% of your total calories per day and limit your fat intake to about 30 grams per day. Avoid trans fats, processed meats, and charred or smoked foods. 5. Smoking. Smoking is associated with a small increase in breast cancer risk. Although the mechanism is not well understood, it has been observed that women known for tobacco smoking have a higher chance of developing breast cancer. 6. Recent oral contraceptive use. Using oral contraceptives, that's birth control pills, appears to slightly increase a woman's risk of breast cancer, but only for a limited period of time. Women who stop using oral contraceptives more than 10 years ago do not appear to have an increased breast cancer risk. Birth control pills are good, but truth be told, there are also risks associated to their use. 7. Exposure to estrogen. The female hormone estrogen is normal for the body and naturally stimulates breast cell growth. Nevertheless, exposure to estrogen over long periods of time without any breaks can increase the risk of breast cancer. For example, taking combined hormone replacement therapy, that is, estrogen and progesterone, for several years or more might increase your risk. Note that hormone therapy is a treatment that has been used for many years to help relieve symptoms of menopause. 8. Stress and anxiety. There is no clear proof that stress and anxiety can increase breast cancer risk. However, anything you do to reduce your stress and to enhance your comfort, joy, and satisfaction can have a major effect on your quality of life. So-called mindful measures such as meditation, yoga, visualization exercises, and prayer may be valuable additions to your daily or weekly routine. Some research suggests that these practices can strengthen the immune system. That is it for the risk factors that can be controlled or changed. Now let's look at some other risk factors that cannot be controlled, cannot be changed, and neither can you reverse them. 1. Gender. Being a woman is the most significant risk factor for developing breast cancer. Although men can get breast cancer too, women's breast cells are constantly changing and growing, mainly due to the activity of the female hormones estrogen and progesterone. This activity puts them at much greater risk for breast cancer, and as you already know, 1 woman out of 8 will develop breast cancer during their lifetime. Age. Simply growing older is the second biggest risk for breast cancer. The risk increases as you grow older. 3. Family history of breast cancer. If you have a first-degree relative, that is, mother, daughter, or sister who has had breast cancer, or you have multiple relatives affected by breast or ovarian cancer, especially before they turn 50, you could be at greater risk of getting breast cancer. 4. Personal history of breast cancer. If you have already been diagnosed with breast cancer, your risk of developing it again, either in the same breast or the other breast, is higher than if you never had the disease. 5. Race. White women are slightly more likely to develop breast cancer than African women. Asian, Hispanic, and Native American women have a lower risk of developing and dying from breast cancer. 6. Radiation therapy to the chest. Having radiation therapy to the chest area as a child or young adult as treatment for another cancer significantly increases breast cancer risk. The increase in risk seems to be highest if the radiation was given while the breast was still developing during the teens. 7. Pregnancy and breastfeeding. Pregnancy and breastfeeding reduce the overall number of menstrual cycles in a woman's life, and this appears to reduce future breast cancer risk. Women who have never had a full-term pregnancy or had their first full-term pregnancy after age 30 have an increased risk of breast cancer. For women who have had children, breastfeeding may slightly lower their breast cancer risk, especially if they continue breastfeeding for 1 to 2 years. For many women, however, breastfeeding for this long is neither possible nor practical. That's it with the non-modifiable risk factors for breast cancer. Now you know all the 15 risk factors of breast cancer. If there's any other risk factor you think was left out, help us drop it in the comment section below so we can learn from you. Just so you know, 60 to 70% of people with breast cancer have no connection to these risk factors at all, and other people with risk factors will never develop cancer. Be sure to talk to your doctor about all your possible risk factors for breast cancer. There may be steps you can take to lower your risk of breast cancer, and your doctor can help you come up with a plan. The doctor also needs to be aware of any other risk factors beyond your controls, so that he or she has an accurate understanding of your level of breast cancer risk. This can influence recommendations about breast cancer screening, what tests to have, and when to start having them. Thank you.